All right. Good afternoon, good evening, folks. Welcome to Dad's Married to Doctors to our live stream. My name is Curtis Webster Jr. For those that don't know me, I am the founder and creator of Dad's Married to Doctors, and we are actually about to celebrate our 6-year birthday, our 6-year anniversary. Yeah, it's been an amazing, amazing 6 years. When I started this group, I was actually, I'm not a brand new dad, but we were brand new to my wife being an attending. We're actually down here in North Carolina. We had just moved from her doing her residency, 3 years in upstate New York. We had done the 4 years of undergrad. We had a child every step of the way. And I was like, man, we're moving to a new place. We're building a brand new house. We're upgrading all the cars. We were pregnant with our third daughter. And I was like, man, there's got to be some folks out there, some guys that can help me understand how to live what we now call this DMD lifestyle better. It's been a phenomenal journey. We're now, like I said, you fast forward 6 years later, we're over 4,000 dads in over 25 countries around the world. And our mission is to empower and educate one another to become better dads, husbands, and ultimately better men. Because we realize and really believe that to impact the physician family, we really need to be that cornerstone to make sure that the family can thrive and survive. Not just survive, but also to thrive. So conversations like today is what I'm really excited about, because this is one of those topics talking about, perinatal mood and anxiety disorders, what I like to just call postpartum depression and all the associated instances. But conversations like today is what I'm excited about, because these topics that people tend to sweep under the rug, especially with guys. I always make the joke that guys don't necessarily look for support groups. A lot of times we go to the bar and get our counsel from Jack, Jim, and Jose. But what happens next? What's the next step? And so DMD was formed so that we could have conversations like this around the trials and tribulations, and also the exciting high points like having a child and how that affects us. Sometimes we're aware of it and sometimes we're not, right? And so I remember when my 3 daughters were born. Like I said, we had Sarai, my oldest, in medical school. My middle child, actually, she will be 8 years old next week. So I know, right? It's crazy to remember when she was first born. We were, like I said, just about to leave upstate New York, and then having our third, my 5-year-old, down here in North Carolina. And just every step of the way, it's funny because my wife and I, we would talk about it, and the word that always came up was anxiety. We would, I would see her kind of dealing with the different emotions of a brand new baby, and kind of crying off in the corner. Oh, wait, no, that was me off crying in the corner. But trying to handle all the joy, the elation, the you're looking for, in our case, the girls were playing, so we're looking forward to these brand new babies, but then they show up and it's like, all right, what do I do here? What's next? We're, especially with the first, we're brand new parents, and we have, we literally felt like we had no clue, or at least I did. Growing up as an only child, I felt like I was thrown into into the ocean with no lifeboat. So I love that we have 2 amazing guests today, Dr. Eynav Accortt and Dr. and Angelina Spicer. Right? We'll call you doctor today, right? And these 2 amazing ladies are going to share their stories. They're going to share their experiences with working with other women, other families, other folks that have dealt with these issues that come along, and very specifically how us as men can support our families, support our spouses when you're talking about postpartum depression, but also how we can recognize the signs even in ourselves and what to look for and what to do. So, Angelina, look, a woman, a lady that needs no introduction, right?
That's true.
So for those of you that don't know Angelina, she is Angelina Spicer. She's a comedian, a social media influencer, and an accidental activist, as she calls it. Most notably, what I want to mention, especially right now, given all the craziness of 2020, she's a cum laude graduate of Howard University, HU, which is also the university of our VP-elect Harris.
Yes. Yes.
Yeah, so Black girl magic all over the internet right now. But Angelina, she is, as I said, a comedian. She's had, staggered over 80 million views. She's performed and has views in over 45 countries all over the place, all kinds of amazing things. She's been a regular sketch performer on both Jimmy Kimmel Live and Conan. I mean, just that's amazing. All kinds of rubbing shoulders to all the big wigs, right?
Thank you. I guess so. If that's what to me, it's just work. your wives do the real work of saving and keeping people alive. I just keep everyone happy and entertained.
Well, you do a great job of it, and I love that. Today you're going to be able to bring, that comedy, but also your real life experience with your own child and with the postpartum depression that you dealt with, and how you were able to recognize those signs and ultimately overcome and deal with everything that happened with that. So, with that, I will turn it over to you. I can't wait to hear your story and let you share it with the fabulous folks that are joining us today.
Wonderful, Curtis. Thank you so much. Thank you to the dads married to doctors. Thank you to my friend and colleague, Dr. Eynav Accortt, for joining today. As Curtis said, I am Angelina Spicer. I'm a stand-up comedian, and I am an accidental activist, primarily because when I decided to have a baby, when my husband and I planned on having our child, I had no idea what was in store, both for my career, my life, and my marriage. As Curtis, as with you, I am an only child, one, and two, my daughter was planned. And we actually decided to wait. We waited 6 years before we became pregnant. And, my pregnancy was normal. Everything was fine. My husband and I, we were elated. We were excited to welcome our baby. And similar to you, Craig, yes, to you, Curtis, I'm sorry, similar to you, when we had my daughter, I was shocked. It was like an out of body experience from the moment that I literally pushed her out and they laid her on me. I thought to myself, like, what's the return policy? Like, I want my money back. This is too stressful. And, my husband was honestly, he was my rock, both during my pregnancy and during my delivery. And I believe in my heart and deep down in my soul that our relationship grew so much during my labor, going to the prenatal classes and feeling like I really had someone there advocating for me, who had my back, who loved me regardless of the smells in the room, how I looked, how long it was taking. Like he was really there for me in a way that he and I both hadn't experienced in our lives. It was really special. And then, we went home. We went home with our baby, and we were both really nervous. We were scared. And we talked about it last night, about the first time we gave our daughter a bath. It was the most terrifying thing. I was like, is her head gonna slip out of my hand? Do we do it in the sink? Do we do it in like a tub? Do we just give her a sponge bath? How do we navigate this? And it was comforting because we were both experiencing the same emotions, and we were experiencing it at the same time, which to me, I learned a lot about how some women or some families who experience these transitions in life at different times, and what kind of impact that might have on one's mental health or on their relationship, because they may feel like their partner is, too controlling or not, or a bit dismissive, or, it just kind of changes the dynamic a bit. But I learned that everyone's relationship, it takes a toll on everyone's relationship those first couple of years.
That's right.
For my husband and I. And, luckily my husband was very supportive of me continuing therapy, continuing, caring for our daughter, breastfeeding. He was really supportive. He would wake up in the middle of the night every night. And I really felt like I had a partner. I felt like we could tag team, and he could change the diaper, and then I would pump, or then I would latch, and then he would burp. I'd go to sleep, and every 2 hours we had like this thing going, this rhythm. The only difference was that my mental health, both my anxiety and levels of depression, were just kind of breaking down. And slowly, and I didn't realize what was happening, and I didn't understand what was happening. I joke on stage about, when you have a baby with someone, you start to hate them. Like, that's just what happens. It's the first rule of Fight Club.
Right.
You have a baby with somebody, you start to hate them. But I wish someone had told me that. I didn't know that that was a part of the makeup of becoming a parent.
That's right.
So I just thought I just hated my husband now. I'm like, oh my God, why, where did you come from? I thought, and we were married for 6 years. So I'm thinking this foundation is set. We're making calculated choices. We're planning. We're on top of things. We're middle class. We're both educated. And here I was just losing myself.
Exactly.
But the difference was I didn't know what was happening to really articulate it to him or my therapist. And, my husband returned to work. I was at home with the baby, but still performing nightly at comedy clubs and still working on Conan and Jimmy Kimmel regularly. So I was stretched because it felt like I was working 2 full-time jobs.
Exactly.
Working was a part of what I love. I love to work, and my husband knows that. So he was very supportive of that. But, I just wasn't able to really articulate it to him. I remember him noticing that something was wrong when I would come home and just start eating dinner in my car. I didn't want anything to do with the baby, with him. Most times, honestly, I would, pump a bottle for her, leave it with him, warm up dinner, and then just go to the garage. And then that's when he called my mom. So he had a conversation, unbeknownst to me, with my mom. And then my mom told him to call my therapist. And he called my therapist. And then the 3 of them did a conference call and discussed my mental health without me even knowing.
Oh, wow.
Yeah. And then I would continuously go to therapy every week. And most times I would bring my daughter with all of the things, the baby Bjorn, the pump, plaque and play, schlepping it to Cedars-Sinai where Dr. Accortt works. Yeah. And because I was very serious about feeling like myself again. I used to feel like my old self died. Like this new life was not what I planned for, hoped for. And I just felt like I lost myself.
Right.
So ultimately at 8 months postpartum, after me trying to, pray it away and, go to therapy and start working out again and talking to my husband and getting more balance in my life, I lost control of my anxiety and depression. And I went to therapy one day and my therapist looked at me and she said, you need to check into a hospital.
Right.
And when she told me that, I almost started running down the highway to go to the hospital because I was so excited and relieved to know that there was somewhere that I could go to get help. Again, that's another thing that we don't discuss in the prenatal period, whether that's when you first get married, when you're actually pregnant, or once the baby gets here. Like, there's no discussion of that. So I went to a psychiatric facility for treatment. It was not the best place to get care. I was the only Black person at this facility. I was the only mother at this facility. But at the time, it was what I needed. I needed a timeout. I needed to check out of everything. And that's what the hospital did for me. I was there for 10 days. I went to meetings. I went to group therapy. I saw a psychiatrist. I got on a very rigid, not rigid, but just some structured medication, which helped within a few days. And then I came home after the 10 days. My mom stayed with us. And then my cousins from all over the country, in Atlanta and DC, in New York City, in Chicago, they rotated literally like a tag team to help my husband and I when my mom couldn't stay. And then that's what got me on this path of really giving a voice and a face to postpartum depression and anxiety, because I realized as a comedian, I just felt like there's so much gold. There's so much gold in my story. But more than that, there's so many other women struggling with the same thing that I was going through. Right. And if I could just add a little bit of light to it. And if people don't feel like it's some, far off thing, that maybe they'll feel prepared
That's
in
right.
a way that I didn't. So that's when we started, working on the documentary, The Push for Permission, so that moms can feel like they are empowered to speak about their mental health and get the treatment. But I really do owe my recovery to my husband. He was right there. He was the first one to notice that something was off. He leapt into action, and he really did advocate for me when I was just lost within my own self. So
That's amazing.
thank,
Wow.
thank you.
No, I love that. I think there's so many, as you saw, I was over here taking notes, writing some stuff
Oh,
down because no, I mean, I think that's key, being in tune with our spouses and being able to recognize those changes within one another, right? I,
yeah, yeah. And I also think too, you know, it helped that we had the foundation. So we had the baseline
right,
of him knowing what my stressors are. He knew and understood that I enjoy work. Work is a fundamental part of who I am.
right.
So, you don't get in the way of Angelina's work. And you also, how to really care for her and how to read the subliminal sort
Exactly.
of clues. So it
You,
was really helpful.
the other piece I love, and then I know you're going to introduce Dr. Accord, but what I love about what you mentioned as well is the not being scared to have a therapist, not being scared to ask for help, not being scared to have somebody that you talk to on a regular basis. I think so many of us kind of write off clinical therapy or write off the ability or the value of having somebody in our corner.
Hmm.
Like I said earlier, a lot of times, especially with men, we think we can just handle it on our own. That if we're struggling with something, we need to just buck up and be stronger or just figure it out. But I'm a real big advocate for having that therapist and having somebody in your corner that is trained and knows what they're talking about. Because I've been told by my mentors, the same thought process that got you into a problem isn't going to get you out of it.
Wow. That's a,
So
yeah.
I think more people need to have a positive view on counseling and therapy and so on and so forth. So I'll let you turn it over to Dr. Accord and tell the rest of your story.
Yes. Well, Dr. Accord has become a great friend of mine. She is my forever friend because I'm never letting her go. But Dr. Accord and I met when I was traveling back and forth to Sacramento, California, working on new legislation to advocate for moms during the postpartum period. And Dr. Accord was one of, I've always felt like an outsider in the clinical psychology in the movement. But Dr. Accord was one of those that had a very bright, down to earth personality, and we honestly just hit it off from there. But I will share her bio because it is super impressive, as is she. Dr. Accord is a clinical psychologist specializing in perinatal and mental health. She is an assistant professor in the Department of OBGYN at Cedars-Sinai in Los Angeles and is the director of the new reproductive psychology program at Cedars. Her research
Nice.
focuses on mood and anxiety disorders during the female reproductive life course and in response to chronic illnesses. She studies the psychological processes that are associated with higher risk for depression and anxiety in pregnancy, postpartum, perimenopause, and following diagnosis and treatment of breast cancer and heart disease in women. She is also interested in the association between maternal mental health and adverse pregnancy and birth outcomes like preeclampsia. She's
Mm.
also she also has a private practice in Agoura Hills, California, called the Perinatal Mental Health Care. I will pass it over to my friend, Dr.
Thank you, Angelina. You're my forever friend too. And thank you so much, Curtis, for having us on today. This is such an important conversation. I'm just so pleased and honored to be a part of it. As Angelina mentioned, we connected a couple years ago and hit it off, and her story's very powerful. You're only hearing a snippet of it today. There's so much more to it that's represented in the documentary, which you'll see a little bit of at the end of our presentation today. So I'm excited to see that with you all. I've been at Cedars-Sinai working on trying to understand why some women develop these perinatal mood and anxiety disorders and others don't. So I do a lot of research, but I also do clinical work. And I really appreciate what you were saying, Curtis, about men, because I do think that's changing significantly, even just in the course of my own career. I've been at it for about 20 years. And, you know, some of the things, some of the ways that boys and girls and men and women are socialized sort of set us up either for success or failure in different ways. And I think it's a shame that when we were growing up, I think we're all about the same age. I might be older than you both, but around that time, you know, yeah, boys were told when they fell off a bike, you know, buck up, don't cry. Like, what are you doing? Get back up. You know, whereas a little girl falls off a bike and it's like, oh, princess, do we need a Band-Aid? You know, what, tell us about it. Where does it hurt? You know? And so there's just a different way that we're brought up. And I think some of that's changing. Some of the ways that boys and men deal with stress, anxiety, and depression is actually really very, very good. So men, again, stereotypically, do a lot of distraction. And I think that's wonderful, right? Something stresses you out. I didn't love your alcohol example, but I will
Just
say,
an example.
yeah, I know, that's okay. That's all right. And that's okay every once in a while, but right. So the idea is, but going off with some buddies and playing basketball or going off to church or doing something with the family or being surrounded by friends, you know, it's a distraction and it's very helpful. So that social support and that activity that you would do with your buddies, you know, that kind of thing. For women, we are socialized to talk, but I think there's a misconception about what therapy is, as if it is just talking to a friend, right? So that's really not what psychotherapy is. And there are a lot of different types of psychotherapy, but none of them are just sitting and chit-chatting like you would with a friend. So like you said, Curtis, we're trained professionals and we're really aware of how to help an individual make the gains and reach their goals, whether that be improve their sleep, whether that be focus in their career, or whether that be a new mother handling this overwhelm. And I wanted to share some slides with you all just to sort of help us kind of focus a brief little presentation here with you all. And I'm going to see if I can get that up and running. But I definitely wanted to start off by saying that there is no, you know, right or wrong. And the way that Angelina was so supported and that her husband was so able to sort of like hone in on what's going on with her and get her connected through her mom to her therapist is truly one of many ways that work. So I'm going to try to get this presenting here, and just a little bit about me. And thank you for that kind introduction. But I think what's really important for us to all be aware of is that some of the ways that we talk about pregnancy and delivery and the stress and overwhelm that comes along with that, you know, it really, you do need to break it down into its different parts. So it is important to talk about baby blues, right? That's very different than what's postpartum depression or postpartum anxiety that Angelina experienced and that many mothers do. So I think, you know, having in mind, like you said, Curtis, with all your moves and your wife's work and your work and the juggle and the struggle, you know, having a baby into that mix, that is a stressful experience, no matter who you are or what you're doing.
That's
okay.
Right.
And there's going to be an adjustment period. Does that mean that you have or she has postpartum depression? Not necessarily, right? So if though your wife, for example, is stressed, overwhelmed, depressed, things do not look quite right, kind of like Angelina's husband, who could say something is off, right? Something is really different here, and identifying that, how can we get her connected to help? And if she already has a therapist, what next, right? So I think this is an important slide because so many of us are told by our mothers, our grandmothers, our aunts, our uncles, our cousins, you know, what's going on here with the positive feelings. Having a baby is going to be the most joyous, wonderful, amazing time in your life. And if you're on social media, you're going to get that just pumped, right? You're going to see moms in white gowns, you know, with their perfect bellies and, you know, no acne, gorgeous hair, gorgeous, you know, just like they're pregnant and then they're with their babies and everything's amazing. Okay. Well, that's possible. But that the other side is also very possible and just as likely. that you may not have an instant love for your baby. And this is, by the way, dads, moms, whoever. This isn't just necessarily for moms. Absolutely feeling exhausted, feeling distant, feeling overwhelmed. Like Angelina said, is one of my favorite jokes of hers. It's like, what is the return policy, right? Like, I don't know that I can do this thing, right? And especially for your first, when you have no idea, you know, and even some disappointment, like this isn't exactly what I signed up for. Like, you know, what I saw on Instagram, there's no breezes blowing and there's no white robes. They're covered in vomit. And, you know, this isn't what I signed up for. So I think there's that heavy stigma. I think that there's this idea, unfortunately, that pregnancy and parenting is easy, it's intuitive, it's instinctive, it's just going to come to you. If you're a good mother, you're going to get depressed. How could you be depressed? You just had a healthy baby, right? So these kinds of statements, these kinds of things really do put a heavy stigma on, you know, kind of shutting down the conversation. Because as I mentioned before, those negative emotions are there. They're absolutely there. So what do you do with those when everybody around you is telling you how easy it is, right? That if you were a good mother, you would just be really, you know, having a ball here. I think that also another side to this is that if I do tell the truth, if I do share with a loved one that I'm struggling, what's going to happen, right?
Right.
Am I going to be judged? Is someone going to think I'm crazy? Are they going to call Child Protective Services? And the reality is that the goal for us as vetted, right, licensed maternal mental health professionals is to connect you and your family to care. That's what we want to do. We don't want to call Child Protective Services. We don't want to get anybody in trouble. We just want to make sure that you are cared for. So as I mentioned before, and I talk quickly, so I apologize. Y'all can, you know, shout out questions to Curtis anytime you want, and I will pause. But baby blues is very, very common. And I would say the majority of new mothers get the baby blues. And that onset of that tearfulness, that anxiety, that irritability, that's day 3 post-delivery to 14 days. If you are having a lot of these symptoms, feeling very emotional, overwhelmed, crying, mood swings, after 14 days, it isn't just the baby blues. So for any doctor out there who's telling your wife, right, or telling you, oh, it'll pass, it's just baby blues, and you're at the 6-week postpartum checkup, no. That's not baby blues. That's not going to go away on its own. So it's really misinformation. The voice, I like to say, of postpartum depression, and this is a really good one for dads to hear, because, you know, I could tell you all the DSM criteria, the Diagnostic and Statistical Manual of Mental Disorders, and blah, 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 and bore you to tears. This is what you're going to hear from your wife, right? This is the sort of thing you're going to want to say. I want to cry all the time. I feel like I'm on an emotional roller coaster. I'll never feel like myself again. I don't think my baby even likes me. Everything feels like an effort. I think I made a big mistake. I'm a terrible mother. I hate the way I look now. This is all the baby's fault. These are the kinds of things that mothers are going to say. And it isn't as common as the baby blues. It's about 10 to 20% of women, and the disruptions are more severe. So whenever I present this to like pediatricians, and they'll laugh about the disruptions in sleep, like, oh, you have a new baby. Of course sleep's going to be disrupted. But that's why I ask the question for my patients in a very unique way, right? I ask, if you had a hypothetical situation and the house was clean and the baby was with your husband or someone you trust, and you're exhausted and the curtains are closed and your sheets are clean and your to-do list is all scratched off, and you lie down in that bed, can you sleep? Yes or no? Someone with postpartum depression is going to say no every time, because they're tossing, they're turning, they're stressed, they're anxious, they're upset, and they can't sleep. Right?
Yeah.
Feeling in a fog, emotionally detached. So now we're getting into those DSM symptoms. But the one I want to point out to you guys, and being mindful of time, is that anxiety is one of the biggest symptoms. And this was always overlooked for many years. That's why we're no longer just calling it postpartum depression anymore. We're calling it perinatal mood and anxiety disorders. And it's because extreme anxiety is so common, and because the symptoms tend to develop or begin oftentimes in the pregnancy. And one piece of Angelina's story that she didn't share with you is that she did start to have some pretty severe anxiety in the pregnancy when she was diagnosed with IUGR, with the fetus was small, right? Growth restricted. And
Yes.
that experience, right? When you were got that diagnosis, worried about your fetus, your baby's safety, health, your own health. Am I going to have to deliver early? Am I going to have a C-section?
It's my fault that she's small.
Oh, absolutely. That is a major and really detrimental thought that a lot of new mothers have, particularly around these pregnancy complications. And some of the reasons I hear, well, I shouldn't have gone to that yoga class, or I shouldn't have had that half a cup of coffee, or I shouldn't have had, and none of that stuff is associated in really good research with these pregnancy complications, yet women still feel so guilty. So I think it's really important to talk about that anxiety. And I think it's also really important to talk about the psychosis, because it's extremely rare and it is an emergency. So if your wife is having thoughts of harming the baby that are not recognized as foreign, so basically she's hearing voices, she's seeing visions, she's acting paranoid, this is not the time to have a conversation with her mom. This is the time to get her to an emergency room and connected to care immediately. Oh, wow. And what I mean by thoughts of harming the baby, so when we go back to that extreme anxiety, negative intrusive thoughts are incredibly common. A recent research study said that 70%, that's 70, the majority of new mothers have scary, negative, intrusive thoughts about themselves or their baby. So that's going to be something like, kind of like what Angelina was saying about the bathing. I had a mom who had to stop bathing her baby because she couldn't stop thinking and imagining herself letting go of the baby and the baby drowning. And that was so scary for her. That's right. She could identify that as foreign and come up with ways to kind of like keep her baby safe, right? But it was also very avoidant. Another mom who wouldn't walk down the stairs with her baby. She asked her husband to do it because of the thought that she was going to drop the baby. Again, that's not psychosis. That's the OCD-like extreme anxiety, and moms would never act on those thoughts. With psychosis, we're looking at hearing voices, seeing visions. This is a true emergency. So I like this little overview for you guys. So you can see here that the postpartum blues will go away on its own. And it's in the first 2 weeks, and it's the majority of new mothers. And then when we get into 2 weeks to even up to a year postpartum, you can have onset. Yes, it's usually in the first 6 weeks. I show you here the majority is in the first 6 weeks, but like Angelina and many others, your postpartum depression may not really be severe enough to be noticeable until months and months postpartum. And stopping breastfeeding is oftentimes one of those times, right? When you wean, it's going to rear its ugly head. And then postpartum psychosis is that one that I mentioned before that's incredibly rare. This is what I was talking about before, and I got ahead of myself, but this is the postpartum OCD. So these are those really scary negative thoughts. They're repetitive. About 5% of postpartum moms have OCD, but 70% have a thought here or there that's scary and upsetting. Thoughts of harming the child, for example. And I think it's important, take home point, if there's any thoughts of harming the baby, let's seek out professional help, but let's seek it out by someone who's really trained in maternal mental health, okay? Because sometimes we go straight to the emergency room and they're not always as well educated. And it could be this OCD, which is highly treatable, not something that's an emergency, okay? So something I like to mention to sort of separate that out. So the last few slides that I have here to go through quickly is just to kind of educate you guys on warning signs, risk factors, and what you can do to help. So if mom had a pregnancy complication like Angelina with IUGR, preeclampsia, preterm delivery, she's going to be at higher risk. If that baby was in the NICU, you're going to be at higher risk, the family. What about postpartum depression in dads? Symptoms are often different from women. So I think it's really important to realize that if mom has a postpartum mood or anxiety disorder, dad's risk triples. Some of the recent research has shown that. So what are you going to be looking for? A lowered stress threshold. You used to be able to take in a lot, used to be able to handle a lot, but now you can't. Increased aggression and anger, feeling burnt out, feeling empty, being really restless and withdrawing. So, the guys invite you for that weekly basketball game, but you don't go, right? That's very unusual for you. Ding, 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 right? There's your red flag. Denial of problems, overworking, there's that drinking and substance use, right? And a refusal to get help. We need to care about this because this doesn't just affect moms. It affects dads. It affects the attachment that the baby has with both mom and dad. And it affects the family and society at large. So we really do need to make this a priority. And we need to focus on protective factors and stress management. So for example, some of the strengths and resiliences that you all have already are going to come into play. These are the things that Angelina already mentioned about her mom being there, her therapist being there, right? So these are individuals who provided that strength. She mentioned starting to get some exercise, right? Maybe even focusing a bit on her nutrition. But I know, because I know Angelina well, her sleep was a mess. The relaxation was out the window, right? So these are some things, and I'm happy to share this, Curtis, with you so that you can share it with the guys. I like to think of this acronym REST. You got to realize that none of these things are a luxury for new parents. These are absolute necessities in order to manage this matrescence, right? This is becoming a parent. It's just like adolescence. It's a huge developmental milestone. And there's a lot that you can do to prepare yourself for that, right? So getting that relaxation in, making sure you're fueling your body and moving your body, making sure you're protecting your sleep, and then T for talking, right? So making sure that if it's a friend, fine, but maybe you need therapy. And I do like to bring this up as I began our conversation, that therapy isn't the same as just talking to a friend, right? So you want to make sure that you're seeing someone who is licensed, and CBT just happens to be the therapy that I do, cognitive behavioral therapy. And what I'm showing you here is just one of many examples, right? So the new mom may think to herself, like Angelina said, I hate my husband now, and this is a nicer way to put it, right? I can't rely on my partner. And then you have a certain behavior. And again, this is no fault of your own. This is because you think that thought, but remember, thoughts aren't facts. That's something we teach in cognitive behavioral therapy. Thoughts aren't facts. So I can't rely on my partner is what you think. And then when your partner tries to help, you turn away. And that behavior makes him pissed, maybe, he's just trying to help. And then he moves away. He's like, well, screw this. She's not going to take my help. I'm out. And then she feels unsupported, angry, lonely. Now, granted, it was partially because of her behavior, but it's not her fault. She's clinically depressed. She's clinically anxious. So what CBT is about is actually breaking this pattern up, right? So it's actually kind of coming in with a therapist and sort of restructuring that thinking and doing different behaviors. Okay, so I know that I'm out of time and I want there to be time for everything else we want to discuss today, but I just think it's really important because I would say 9 times out of 10, my patients are saying, I don't want to take any medications in my pregnancy because I don't want to harm the fetus. You have to understand that exposure always occurs. And even when you're breastfeeding, even when you're pregnant, it is very likely, and I'm not a psychiatrist, but very likely safer to expose the fetus to a small amount of this SSRI, this antidepressant, than it is to expose the fetus to your disease. So it's something that you really do need to think about, but it isn't an easy decision, and you probably need to see a reproductive psychiatrist. I can help you guys get connected to one of those. Breastfeeding, push and pull here. It is amazing in what it does, releases oxytocin, can help with bonding, is anti-inflammatory, but there can be struggles. The struggles around breastfeeding are real. And if you don't have a great connection there, if you really struggle to breastfeed, that can compound your guilt, your shame. You got to respect the woman's decision. And a depressed or anxious woman may need extra support, right, to be able to breastfeed. So I think what my focus in my career and what I hope to bring home as a message to you all, and what Angelina is helping us do more society-wise and outwardly, is to reduce these barriers, right? Reduce these feelings of guilt or shame. Reduce this religion is amazing, right? But you can't pray it away. These are treatable conditions. There are medications and psychotherapies that work. And so we need to reframe depression. Maybe we just stop using this word. At Cedars, we talk about mother and child and family wellness. We build relationships of trust. We do this in an open, non-judgmental way. We want moms, we want dads to realize they're not alone. They're not to blame. And with help, they'll get better. So the last thing that I will say, if this actually wants to go, or maybe not, is to let you guys know that you can really support your wife in really simple ways. Maybe it's just driving her to that therapist appointment, or just being with the baby so she can go. Maybe it's lowering your own expectations, helping your mom, right? Her mother-in-law, lower those expectations. This is a tough time. Really encourage even more than you normally do. The best dad still needs to remember this is really a tough time. And to help her realize that kind of a pet peeve of mine. Yeah, honey. Yeah, no, go take a shower. That's your good self-care. No. Showering is hygiene. That's just basic. Okay. Then she needs time to get sleep, to do some relaxation, to go get some exercise, to eat healthy. These are self-care, right? So I don't know what's happening to my PowerPoint slides, you guys, but I think, the last couple things that I will mention, if they haven't disappeared entirely, is to my last piece of advice. Your positivity, your action, and your words are going to reduce her suffering. Know how much power you have in your relationship, and encourage her to seek help. All too often, women quit too soon because they're actually feeling so guilty about their husbands taking on too much. Encourage her, listen to her, support her. Her feelings are real, so let her express them to you. And like I said before, allow her to focus on her own needs. Finally, and really critically, you guys have got to take time for yourself. You've got to go out and continue the work you do that's so important, your hobbies, your outside relationships. And, you need to do that, because you're not going to be able to be supportive for her if you're not okay.
Right.
And so I'm happy for you guys to reach out to me anytime, direct message on social media. Angelina knows how to find me. Now Curtis knows how to find me. And you guys can say, like, this is what I've got going on. This is what my wife's going on. We live here. How can I get help? And Postpartum Support International, unless you're in California, I can directly get you connected if you're in California. But if you're not, we've got some great resources. We can help you anywhere in this country. So again, thank you so much for including me. I love to, anywhere Angelina goes, I'm like, sign me up. So
That's right.
And thank you, Curtis.
Oh, most definitely. Thank you. That's such amazing information. Oh, wow. That's so good.
Right? I told you, Dr. Accortt, she the bomb.
Right? Exactly.
She's actually a consultant on our documentary, The Push for Permission, to make sure that we don't veer too far off into the comedy, that we lose the facts.
Right.
We want to definitely reduce stigma, but we want to make sure that that the information is medically accurate. I did not go to medical school, and I only have a bachelor's degree. So we want to make sure that we're not leading moms and dads astray. Did you want to interject here, Curtis?
Yeah, no, I was just going to ask you a couple of quick questions before we break into the preview, and then talk a little bit more about the documentary. So Dr. Accortt, such great information. Like I said, I love it. And I think the main reason I wanted to do this, and why I love having these conversations, is just bringing this kind of stuff to the forefront. A lot of times we don't think about it. For me, my youngest is 5 years old. So the last time I thought about some of this stuff was, 4.5 years ago, 4 years ago. I mean, you start to get out of those moments. But as you started talking about it, I remember how real some of those challenges were. When my wife, I remember, we had, we thought we had it all planned out, Angelina, like you were talking about. With the first week, we were like, all right, we're going to get pregnant. And we did. We were like, we had the girl. We thought it was going to be a boy, but ended up being a girl. So very quickly, we realized our plans weren't going to be exactly as we expected. But I remember my wife said, I want to breastfeed. I'm going to breastfeed for that first year. We're not going to supplement. We're not going to do formula. And first night in the hospital, it wasn't flowing. She couldn't get the latch, couldn't get all those different things. And then ultimately we ended up having to supplement. And I remember her saying some of those different things. Oh, I feel like a failure. I'm my bad
body's
mom.
broken.
My body's not working right.
Yep.
And just all those different feelings. I was like, wow, it was surprising. It was shocking.
Yeah. And I do like to talk about that with moms. I think from Angelina and I have spoken a lot about this, that the expectations are different from the reality. And if we could all just please be honest, we don't need to scare these new moms, but we just need to be honest.
Right.
Breastfeeding works beautifully and easily for some women, and it's more challenging for others. That's okay.
That's right.
I talk about not having a postpartum or a birth plan. Have your birth preferences, right? Like just preferences, because it's what's gonna happen is gonna happen, right? Yeah.
No, I think that's great. I remember we went in like thinking we were going to have this plan, and I wish they would change that word, because you're right. We're like, all right, cool. This is how we want this to go. My wife didn't want an epidural. She ended up getting an epidural.
That's right.
Granted, she was 10 centimeters when she got the epidural, or 9 centimeters. She was right there at the end. She was close to the end. They were like, you're there, but whatever
That's
works.
Exactly.
I'm like, dear, whatever you want to do.
Yep.
So yeah, a birth plan can be very misleading, right?
Very, and sets you up to feeling like a failure when you're not. You're
exactly.
not. Yeah.
Oh man. And then one other thing I wanted to ask you about, because I think this comes up, especially in the physician community. And I don't know if it still exists. I feel like it probably does. Maybe some of it is more internal, but the stigma that if a physician asks for help, it's going to go on the record, and then they're no longer going to be able to work as effectively, or it's going to follow them in their professional career. So what happens with the stigma of a physician getting help?
This is a huge problem, and this is something that will continue to be a huge problem. I'm so glad you brought it up. One thing that I do, wasn't even really aware of it until I really joined the medical teams. But what I offer, both in the reproductive psychology clinic at Cedars and in my own private practice, is to do stuff completely off the books in the sense of no insurance, and have it be sliding scale fee or having it be a lower fee, and that's really for anybody who doesn't want this to be on their insurance. And then there's no way to follow that. I think that is a really significant and severe problem, because quite honestly, the mental illness isn't going to go away because you don't treat it. So they're really doing a disservice to their patients by not getting the care that they do really desperately need, so that they can be the best doctor, husband, wife, what have you. Mm-hmm. So yeah, I mean, thankfully, again, Curtis, I've seen that change in the last 20 years.
Exactly.
I do think it's becoming less stigmatized. And certainly I'm hopeful that, as pregnancy and postpartum was the most stigmatized maybe 30 years ago, and now it's actually, we're getting the word out so much that maybe it will be some of the first mental illnesses that are destigmatized. That's my dream, right, Angelina? Like,
that is definitely
because I think there's such a biological, I hate to say this, but with the physicians in the house, everything, if there's not a biological clear explanation, it's like it doesn't exist. Right. And I joke with the physicians, like, oh, a mind-body connection. It's like, yeah, my brain and my body are connected. It's called my neck, and there's a spinal cord. I mean, did y'all not learn about that in medical school? Like, come on. So I think with pregnancy and with the hormonal shifts, and with learning more and more about why some women are more sensitive to those hormonal shifts and inflammation, and how all this is involved with our neurotransmitters, there is going to be more acceptance. And, I like to give the analogy of diabetes. Right. If you got a diagnosis of gestational diabetes, would you hide it? Because you didn't, or for someone, a man who's older, is he going to hide the fact that he's got that diabetes diagnosis? Right. No. Will he go straight to medications? Maybe not. He'll do some of those lifestyle changes, right? Like I suggested, better sleep, better nutrition, exercise, just like mental health is physical health is mental health. I would love for us all to just get on the same page about that. Angelina's helping.
No, I think that's great. And so I think one of the ways that you're helping to really kind of destigmatize it and get the word out and help people to have these conversations more effortlessly is through your documentary, right?
Yes, definitely. You know, we call it the push for permission, societal permission, permission from our peers, permission from our families, even permission for making this documentary happen, so that moms don't suffer in shame and in silence. You know, I realized when I got out of the psych ward that too many moms were going through exactly what I was going through, but were too ashamed to share, mostly in my DMs, in my direct messages on social media. You know, there was a police officer that reached out to me and said that she wanted to get treatment, and wanted to go to a therapist, but was afraid that her job would put it on the books and she would be labeled as clinically depressed, and then it would prevent her from getting promotions, etc. You know, moms have reached out to me, and dads, not dads of divorced relationships, have reached out to me and said, this is why my previous relationship didn't work.
Exactly.
Because I didn't respect what my wife at the time was going through. You know, or my wife is a nurse. This is going to help so many people. My wife is a nurse and she also went through it and struggled, you know, so I'm really just advocating that we add some life, some humor at times, but also educate just regular people who don't have doctors, you know, who don't have PhDs or MDs, you know, and the goal is to get them before they have their babies. So I'd love to show everyone a clip from our Kickstarter. We are still raising funds for the documentary. We're about 80% there. So any little bit will help. But Craig, I'd love you to show it.
Yeah, and while I pull it up, where can they find the Kickstarter? Where can they support the
On
push for?
Yes, on my website, www.angelinaspicer.com.
I love it. I love it. All right, can y'all see the video?
Yes, we can.
All right.
I'm Angelina Spicer. Anywhere there's a comedy club, comedy show, Angelina Spicer has been through there.
Be honest, this is baby make me look pregnant.
How the hell did this shit happen? Oh, baby. I'm a new mom. They put my daughter on me for skin to skin, and I was like, what is the return policy? She's fed, she's changed, and she's still screaming. Here you go. I knew something was wrong when I felt so overwhelmed that I would eat dinner in my car. I am trying to figure out how to juggle everything. My postpartum depression and anxiety was almost immediate. It just ballooned.
And at first I was in denial. I was like, dang, that's a fucking white girl's disease. Like, I don't know.
We check mothers for preeclampsia, gestational diabetes, but postpartum depression and anxiety is more common than any of those other ones. 1 in 4 women experience postpartum depression. PPD, how can I explain it? It's what the doctors name it. When you're crying, laugh at the same time with it. P is for post, other for partner after baby. The last D, well, that's not that easy. Bust it. You're sort of like you're happy and you're sad. It's a contradiction. Work, postpartum depression, and postpartum anxiety led me to a psychiatric hospital.
But like when it hit me, I was looking out the window and I was like, God, I wonder how far I can make it with 2 broken legs.
For a very long time, that was off limits. People want to sell you this fake fantasy on Facebook about how wonderful, oh my God, my heart is beating outside of my body. And because we don't talk about this as women, as mothers, how hard it is and how it doesn't let up, you think you're the only one. Too real? Like, show me that struggle on Snapchat. That's the real shit. That's what comedy is, you know? You live, you experience things, you have tragedies, you find new things to laugh about. That's my time. Y'all have been great. I'm Angelina Spicer.
All right.
Yes. So the goal is to complete the documentary by the end, to complete shooting the documentary by the end
Right.
of the year. We've changed legislation. We've gone to Capitol Hill. Dr. Accortt and I went up to Sacramento many times. We've gotten legislation passed. And the next step is to get our documentary made, finished, so that we all have the language, to communicate our feelings, our emotions after we have kids, so that we can all get help without stigma.
There you go. It's interesting. There's so many pieces to that, because a conversation we have a lot of times in the group is leave. Paternal leave as well as maternal leave, and having that time to cope with your feelings, to bond with the baby, to figure out what this new normal is going to look like. So there's so many aspects of all this: the mental, the legal, the physical, the societal. So I love that you're bringing these things to the table. So AngelinaSpicer.com is where people can learn more about the Kickstarter, learn more about the documentary, different ways they can support you, and just keep up with the journey, right?
Yes, for sure. And on Instagram at Angelina Spicer. But the support on the documentary would be most helpful.
Oh, there you go. One of the scenes you had in there with you handing the baby to the dad. Lord, I remember that so much. I remember my wife and I actually going to counseling and talking about that whole transition. Like, can I come in the house? Can I, change my clothes before the handoff happens? But it's real though.
You walk in the door and that baby is coming straight to you. Here you go.
That's right. It's game time.
Gotta go.
Oh man.
But it's an important conversation to have, Curtis. That is an important, and we don't realize that if we don't communicate our needs both directions. So for you to say, I just need 5 minutes. Mm-hmm. After that 5 minutes, I am 110% yours or the baby's or both, or cooking dinner or whatever. But I do need that. And so communicating that instead of growing resentful. And I think for mom too, to understand, okay, of course that makes sense. He's been at work all day. Yeah, I've been working here all day, right? And exactly. I think that's what's the hard part is mom is struggling. Like, I've got a 24-hour-a-day job with no breaks. You got lunch, hon. Right. I don't know that you really deserve another break right now. Right. But that's a conversation. That's and right. I think too many couples don't have that conversation. They spend way too much time discussing what color the paint in the wall of the baby room should be, and that isn't the conversation that's really important.
Oh man, that dreaded C word, that communication.
Ooh, that's it. You got it.
I love it. Well, thank you all so much for being here, Dr. Accortt. Thank you so much for your time and expertise. Angelina, absolutely. I love it, bringing the comedy as well as bringing the seriousness of this whole thing to the forefront. And as I mentioned at the beginning, that was what was on my heart 6 years ago now, almost at this point, when I was sitting we were upstairs here in the house, and we were talking about the third baby coming along, and I was like, man, I realize I can't do this as best as possible on my own. I need some input. Let me not try and be as my shirt says, the superhero. Let me reach out to others and build up that support community so we can all learn how to be better.
I love it. I love what you're doing. I fully support you guys. You let me know I'm happy to come back. Happy to answer questions. Take off that cape though, dads. You guys, you don't need to be superheroes. Just be right there with mom, and you're going to be okay. Mom, take off the cape too.
I was going to say, I tell people all the time, she's wearing the cape out there saving lives.
No one's wearing a cape. We don't want to put anybody high on any pedestals. We just want everybody communicating and getting their needs met.
There you go. Like I tell the guys, we talk about it's no longer happy wife, happy life. It's happy spouse, happy house.
I like that.
See, hashtag.
Let's do it.
I love it. But folks, y'all can find me and all these recordings like this at dadsmarriedtodoctors.com. We're about to release our new podcast. So information and conversations like this is what we're looking to do on a regular weekly basis. So thank you all so much for joining us today. Thank you to our guest, and we'll see you next time.
Bye. Have a great evening.
You too, guys.